Have doctors said you or someone you love needs a feeding tube? It can be a lot to process, and you may have a lot of questions. This video will tell you what is a feeding tube and why do people get them? How long do people have feeding tubes? What types of feeding tubes are there? Will you still be able to live a full life with a feeding tube? What are some resources where you can learn more and get help? Please be aware, this video is only for informational purposes, and you should always talk to your doctor. Some people have health or developmental conditions that impact their ability to eat by mouth. A feeding tube helps supply nutrition to those who need help. For instance, some have trouble swallowing and may choke on food or fluids. Many premature babies or babies with health conditions use feeding tubes to help them gain weight safely, at least temporarily. Others may be on a ventilator or are too sick to swallow. Some people inhale foods or fluids into their lungs, what doctors call aspiration, and what you may call going down the wrong pipe. This can lead to serious health problems, including pneumonia. Some people have trouble digesting foods or getting adequate calories or nutrition from eating by mouth alone. In fact, there are over 350 conditions that can require a feeding tube. Some people use the tube to take all their dietary needs, and some may still eat or drink by mouth and use the tube only to supplement their needs. If you or someone you love needs a feeding tube, a doctor will explain to you which tube they are recommending. There are many good resources for understanding feeding tubes and getting support. An excellent resource for kids is the book Tubey Kids Like Me by Annette Fournier. The book is narrated by a child who explains why she has a tube, different kinds of tubes, how feeding tubes work, and why it's perfectly okay to eat differently than other people. It's a great way to help kids understand why they use a tube, why someone they love has a tube, or to read to friends, relatives, or classmates to explain why a person uses a feeding tube. The book is available through Amazon. Another good option are organizations that provide teddy bears with feeding tubes to children. Some people have bears donated to them, and some people make their own. There are several Facebook groups where you can ask questions of adults who have feeding tubes or parents of kids with tubes. There are also many online support organizations, such as the Feeding Tube Awareness Foundation, that has educational and support resources. There's a lot of support available, so don't feel like you have to do this alone. Feeding tubes can be temporary or long-term. Some people may use a feeding tube for only a few days, weeks, or months. Some may use them for years before weaning off them, and some may have one for life. It just depends on the individual and their specific health needs. There are several kinds of feeding tubes. Temporary tubes include NG, OG, ND, and NJ. These tubes are to temporarily feed someone for a matter of days, weeks, or months. They are not intended for long-term use. A temporary tube, like an NG, can be inserted in a doctor's office or hospital room. It's typically done without anesthesia and may be temporarily uncomfortable or painful for the patient. It can be done as an outpatient procedure. An NG, or nasogastral tube, goes in the nose, down the throat, and ends in the stomach. An OG tube is like an NG, except it is inserted through the mouth rather than the nose. ND and NJ tubes are also similar. They both go through the nose, down the throat, and past the stomach into the intestines, but they go to different places in the intestines. They are used for people who cannot tolerate feeds directly into the stomach. There are also tubes that are surgically implanted that are intended for longer-term use. A G tube is surgically implanted in the abdomen, so food can go directly into the stomach. A G tube is sometimes called a PEG, although there are slight differences. A G-tube can either be long and hang out, sometimes called a dangler, or it might be small and flatter to the skin, often called a button. Some people cannot tolerate foods directly into the stomach, and they may get a GJ tube or a J-tube. These tubes allow food to go directly into the intestines rather than the stomach. A GJ tube allows for venting, so gas or other contents can be removed from the stomach. Long-term tubes are inserted surgically while the patient is under anesthesia. There are different methods for insertion, but the surgery is a relatively short and routine procedure. Before the surgery, the patient won't be allowed to eat or drink for some hours. Afterwards, the patient will spend a few days in the hospital recovering. Nurses will teach patients or their caregivers how to use the tube and how to clean it and care for it at home. The place where the tube is inserted is called the stoma. The patient will have some pain as the stoma site heals. After the stoma site heals, patients can return fairly quickly to their normal lives. Some patients will eat via bolus feeds, also called gravity feeds. A bolus feed is poured into a large syringe, and then slowly the meal drains into the stomach. Some people will use a feeding pump that pumps food into the body at a slow rate over several hours. People with GJ or J tubes must use a feeding pump. A feeding pump can be carried in a backpack, so people can still go about their daily activities. For infants, people with complex health, or those who use wheelchairs, feeding pumps can be attached to an IV pole, wheelchair, or stroller. The nurses will teach you how to use the equipment and how to vent the tube, which means to remove gas from the stomach. Most people use formula or blended foods in the feeding tube. You can get these from a durable medical supply company or buy them commercially. Some people make their own blended foods. Be sure you have guidance from your doctor or dietitian before doing a blended diet. There are many blogs, Facebook groups, and cookbooks to help you do blended foods. Upon leaving the hospital, you should be connected with a durable medical supply company. You can order tube supplies and formula from them. The amount of supplies you receive and the amount you pay will vary based on your insurance or benefits, and some things might not be covered. Call your insurance or benefits provider to find out more. If you have trouble getting supplies, there are nonprofit and parent organizations, such as Facebook groups or the Parker Lee Project, that share excess supplies. Some people may get feeding therapy from a speech therapist to work on being able to eat by mouth. Some people may keep the tube for life, but some people can have it removed if their medical situation changes. Tubes can often be removed in a doctor's office, and the stoma will close on its own. If a tube is pulled out by accident, it must be replaced quickly to prevent the stoma closing. For some people, a minor surgery is required to close the hole. A feeding tube doesn't have to slow you down. There are lots of tools that can make life with a feeding tube easier. There's a thriving community of people who will support you during your feeding tube journey. Finally, you can find loads of resources that will help support you in your day-to-day life. You are not alone in this journey. Reach out for help and join the larger tube feeding community.